Okay, in this section, we're going to be talking about care of a patient who underwent orthopedic procedures. The common orthopedic procedures for upper extremity, like carpal tunnel release of hand decompression. So you might see a patient that has a kind of like a hand compressed, like kind of like this. And then they would do kind of release the contracture to give the mobility back on their hand. Joint replacement can be done in any joint and to improve the patient with RA or other degenerative diseases. ORIF of upper extremity is very common in pediatrics. They kind of ride the bike, they learn how to ride the bike, they fall, they break their forearm. You often see this during the summer. And they'll be doing surgical placement of hardware to maintain the position of bones for proper healing. Rotator cuff repair, shoulder repair of muscles and tendons of the rotator cuff in the shoulder. And a procedure like that are very common. The patient who does like a tennis or older patient that uses quite a bit of shoulder. And for orthopedic procedures, it's really important to know which nerve supplies to which area. So for example, for arms, you need to know which side of the radial nerve supplies. So radial nerve kind of towards the thumb side, right? So those two fingers are often affected by radial nerves. The patient with a carpal tunnel syndrome often complain numbness there. And this radial nerve goes all the way back here. See all the pink? If you work in orthopedic area, you really need to know what nerve supplies to where. But for CPAN, I don't think they'll be asking too much questions about it. And just need to know the general care of the patient who underwent orthopedic procedure. The ulnar nerve, on the other hand, more towards the pinky and ring finger. So the patient with ulnar nerve compression often complain numbness between the pinky and the ring finger, and it supplies on this side. Medial nerve on the middle, and you have a musculocutaneous nerve towards the forearm of that arm. Beer block is commonly used for patients who is undergoing like carpal tunnel release. What is a beer block? It is a IV regional anesthesia. What they're going to be doing is they're going to put in the IV and they will inflate the blood pressure cuff. It looks like it's a blood pressure cuff, but they inflate it and then they would inject lidocaine. So it'll infiltrate right here and it'll provide local anesthetic there for quite a bit of time. It definitely lasts longer than surgery. But when the patient wake up and they start feeling that fingers kind of getting tingly and stuff like that, usually signs that, you know, the local anesthetics are wearing off. So they might need to start taking their oral pills and stuff like that. So let's talk about lower extremity procedure like ligament reconstruction. Again, you don't really need to know all these ligaments. Just know the general care of orthopedic patients for sake of CPAN. But again, if you work in orthopedics area, you do need to know which ligament was replaced and stuff like that. Usually result of sports injury. Replacement of damaged ligament with autograft, meaning their own ligament, or allograft, that's a graft that's taken from something similar, genetically similar species, or synthetic ligament to return stability to the knee after tear. Meniscectomy is a removal part of meniscus, that's a cartilage of the knee using arthroscopic technique. Osteotomy is a cutting a bone to change its position for weight bearing or to correct an abnormal curvature. Patellar bursectomy, excision of bursal wall and calcifications. Okay, the other orthopedic procedures you might see, it's really important to know the nomenclature of those things, especially when you work in a surgical area. So arthro, that it means that's related to joints. Scope, we are putting tiny little camera in the joint to look at the structure. It can be done in any joint like shoulder, wrist, knee, ankle, and it can be done in hip too. Diagnostic arthroscope is usually done with something else. So they might be doing debridement, biopsy, meniscectomy, ligament repair, or removal of loose bodies. Bone and muscle biopsy can be done arthroscopically or open. They might be doing cast exchange, close reduction of fractures, cyst removal, excision of ganglion, joint manipulation, especially after like a joint replacement, the joint got stiff. They need to really loosen up that joint again, and that's very painful. So they do it under anesthesia. Arthroplasty, meaning that is a replacement, surgical resection of a joint with replacement with prosthesis. Tendon transfer, transference of tendon and insertion point to different positions to improve muscle function. They could be amputating, and replantation could happen if the body needs to be reattached. Okay. The complication common to orthopedics that you need to be aware of, that is deep vein thrombosis. So even if the patient's just getting arthroscope, they are already at moderate risk for developing DVT, even they are healthy. And high risk, especially for lower extremity surgeries with the coexistence of peripheral vascular disease, malignancy, stroke, pregnancy, cardiac disease, smoking, dehydration, and sickle cell disease. Prevention is the key. So you want to get the patient up and moving as early as possible and make sure the patient is well hydrated, and you're going to be using regional blocks so they can get up early so we can prevent the vein thrombosis from developing. Anticoagulation, mechanical prophylaxis, so put on the SCDs on the patient. And the signs of symptoms of DVT or PE, shortness of breath, tachypnea, restlessness, some chest pain, growls, cough. They might be coughing up blood, pulmonary friction rub, hypoxemia, and tachycardia. Treatment depends on how big is the clot is, where it is too. But anticoagulation and support the airway, breathing, and circulation is the key. For the patient, especially with like a hip procedure, can throw a fat embolism. Fat from the marrow and the tissue of broken bones embolize to the lungs. Possibly happen at any age, but trauma, fracture of long bones, more than one bone, close fractures, joint replacement, delaying treatment of femur fractures increase the incidence. The signs of symptoms of fat embolism include confusion, anxiety, tachypnea, shortness of breath, pulmonary edema, tachycardia, dysarrhythmias, and chest pain, hypotension, petechiae of trunk or conjunctiva, and you might see pyrexia. Treatment is very supportive, so you're going to support the ABC, might be giving some diuretics and corticosteroids and stuff like that. Another complication you need to be aware of for orthopedic procedure, compartment syndrome. It is uncommon in general population. It's mostly associated with fractures or injuries to the lower extremities. Comprehensive neovascular assessment is so important in orthopedic procedures, especially for lower extremities. Again, there are higher risks. So 5 P's that you need to be aware for compartment syndrome. So this is very important, and when you are reviewing for CPAN, you need to know like a general how to recover the patient and in this orthopedic umbrella, and you need to know the common complications and common assessment, common interventions. So this is very important. You're looking out for signs of symptoms of DVT, PE, fat embolism, compartment syndrome. Compartment syndrome, you are looking for this 5 P's. What are the 5 P's? Pain. And it is the most universal symptoms related to muscle ischemia. And it is usually extreme and unrelieved pain aggravated by passive flexion or extension of the limb. Involves the entire compartment. It is not localized to one area. So like if the patient's complaining just the knee pain, it's probably not it, but the whole extremity, and it just gets worse with the passive flexion. It could be a signs of symptoms of compartment syndrome. Pallor, paresthesia, pulselessness, and paralysis. They are later signs of symptoms, but they are the 5 P's you need to be aware of. You want to prevent compartment syndrome if possible. So how do I prevent compartment syndrome? You want to elevate the limb above the heart. So that's why when you recover a patient and had an orthopedic procedures, you are elevating the limb. And we'll talk about that in just a little bit, but you want to elevate the limb above the heart. You want to ice that site. But if you think this patient is experiencing compartment syndrome, here's the things you need to do. First, notify the surgeon right away, right? You need help. And assess every 15 minutes very, very frequently. And maintain the limb in neutral position at heart level. You want to remove the ice at this point because what does ice do? It constricts the blood vessels. It's going to reduce the circulation to that limb. So remove that ice. Release that restrictive dressing, or if you have a patient with a cast, remove it. And you want to provide anesthesia and get accurate I&O and prepare the patient for fasciotomy or surgical decompression. Okay, special consideration for the patient who had a hand wrist procedure. Again, we talked about beer block IV regional anesthesia. It is a rapid onset and it's very reliable pain management method, but it is only last for only about 90 minutes. It's not that long of a time. It's perfect during the surgical time. However, by the time they come to pack you, recover, ready to go home, it's starting to wear off. So we need to have an alternative method to manage that pain. Rotator cuff repair, you want to make sure the patient's arm is supported. And often they have a regional anesthesia and they may not able to move the extremities well, or they'll have a feeling. So when they go home, if the arm is just dangling around, they might burn themselves on stove and stuff like that. And the regional anesthesia is very effective. They might not need additional opiates, but they might have severe pain if the patient don't have regional anesthesia, or regional anesthesia didn't work for the patient. So that's why the procedures are pretty painful. But orthopedic procedures are pretty painful in general. Spinal fusion and stabilization. Posterior spinal fusion, spinal fusion can be done in a different way. It could be from the back, posterior, or it could be anterior, or it can be combined, both anterior and posterior. And it can be done on the same day, or it can be staged to a later day. For those patients, it's really important to do a neurovascular assessment as well, and often pretty frequent. Every 15 minutes times 2 hours, and every hour. Assess for the patient for headache. Could be signs of symptoms of spinal fluid leak. And especially with anterior approach, when they come through the front, and it can cause a tracheal edema or compression of the trachea. So really important to assess the airway and airway management with those patients. And you don't want the patient to be twisting around too much, so roll the patient. Okay, so general guide for orthopedic post-op care. Remember, price, protect, rest, ice, compress, and elevate. That is the general guide for orthopedic patients. So protect, what does that mean? Position that limb, elevate above the level of the heart, or keep the joint in neutral alignment like your hip. No extreme flexion and abduction to prevent dislocation. And some of the procedure will require post-op x-ray to make sure the patient don't have dislocation of the joint. An assessment of those patients. Neurovascular assessment is very important for orthopedic surgeries. At minimum, do every 1 hour for the first 4 hours. Peroneal nerve, that's a foot drop, and tibial nerve for lower extremity hip surgery. So that's something that you want to assess quite frequently for the patient who had a hip surgery. Are they developing foot drop? Medial nerve assessment for upper extremities. Like earlier I talked about, you really need to know what nerve supplies to what, especially if you work in orthopedics. Pain control. Again, orthopedic procedures are very painful procedures. So they do a lot of different ways to manage the pain, and often they utilize regional blocks, local anesthetic, and multimodal analgesia, and they are an ARAS protocol. Cryotherapy, so they're going to be putting on ice to reduce edema, inflammation, pain, and a potential for post-op bleeding. And activity, they might be up and walking almost immediately after surgery. An active run makes sure the joint moving, and they might be using CPAN machines, for example, for like ACL surgery to keep that ligament moving. All right, let's look at practice question together. Which one is the most significant complication after total knee arthroplasty? So the key to answering those certification questions, you want to look at the keywords. Here is the most significant. So if you think about total knee arthroplasty, what are some complications you might see? You might see some of them here, right? But what are the most significant one that you might see? And so what could kill the patient? So think about that. So all of them could kill the patient, but most significant is deep vein thrombosis. So lower extremities, you have a higher chance of developing DVT, like I said earlier, right? You want to look for the signs of symptom DVT, and like hip procedures, you might be putting on additional thing like a perineal nerve compression and a fat embolism. But total knee, you could have a compartment syndrome too, but again, most significant one would be DVT. They are at high risk for any time you work on a lower extremity procedure. Okay, what is the common cause of foot drop injury with symptoms of decreased sensation over the dorsum of the foot and inability to bring the foot up? Which one was it? You might see this with like a hip procedure. So that one is A, perineal nerve compression. So what about this one? A patient is admitted to the pre-op unit in preparation for a triple arthrodesis on the right foot. So if you don't know what this surgery is, again, you do want to look at the nomenclature of this. So when you're starting for CPAN, look at those nomenclatures. What is the otomy mean? What is the arthro means and stuff like that? And it kind of gives you an idea what kind of procedure that is. If you know arthro means something with a joint, so that's an orthopedic procedure, and it tells you it's on the right foot. So pertinent baseline assessment for this surgery include which one? Color and temperature of the right foot and toes. Just right foot? Or do you need to know both? That's a good question, right? Okay, move on. Range of motion of the right foot and toes. Okay. Sensation in right and left feet and toes. That's probably right? If you are recovering this patient, you want to know if this patient already had a numbness on the left side. Or is it caused by positioning of the surgery, right? So you want to know both. So anytime you're assessing a patient, you're assessing both sides. So yes, C is the correct answer. All right, here are my references. And the next I'll be talking about regional anesthesia.